The coming into being of the College of Physicians and Surgeons began in 1993 with the constitution of a postgraduate medical advisory board by the then Health Minister, Commodore Steve Obimpe. However, it would take the effort of others 10 years later to establish the college. With a $5 million support from the Netherlands, the current premises was built. Since then, the college has played a significant role in raising the standard of medical practice and curbing brain drain. From the first admission of 61 residents and 14 doctors, it has trained 1,690 specialists, 200 senior specialists or fellows with 16 faculties, 7 major training centers, and 38 rotation sites as of 2022.
The college certainly needs more financial support for the effective execution of this mandate, and in particular for expanding the areas of specialization. It needs to keep abreast with global medical developments and also take into account the new demographics, such as the aging population.
Although there is an increasing demand for postgraduate medical training, the college is highly constrained. Delivering the opening lecture for the college's 20th anniversary, the rector, Professor Richard Adanu, celebrated the achievements, assessed their needs, suggested plans for improvements, and stressed the need to be abreast of global medical developments.
Quality assessment and quality improvement needs have been raised by several people in the past, with Prof. Ladewa Sonu being one person who continues to talk about it. Unfortunately, we still do not have robust functioning quality assessment systems, both at the level of continuously assessing the training delivered and the effect of the training on the trainees. We have established a number of subspecialty training programs, but our hospitals do not have all the equipment required for these subspecialists to be able to function fully.
The Minister for Health, Mr. Kweku Agyemang-Manu, said the ministry has secured Cabinet's approval of its policies to ensure that doctors begin their postgraduate medical training earlier than usual.
We are currently working on getting a formal policy on the funding of postgraduate medical training established so that the funding system will not be solely dependent on the government.
With the needed funding, the College of Physicians and Surgeons hopes to decentralize its presence across the country by building 2 simulation centers to train more specialists. It further appealed to government to build 2 well-equipped hospitals with capacities as the Komfanoche and the Kolebu teaching hospitals, and good infrastructure outside these locations to enable specialists to take up postings. Sarah for GBC News, Accra.